Thank you, everybody. I'm delighted to be here. And could I just start again by thanking the Flanders Agency for Health and Care and ICIC for what's been a really, really enjoyable and inspirational few days. I was thinking about it this morning, about the conference, and I think for me, one of the main takeaways has been the sheer talent, enthusiasm, and passion, I think, for integrated care. And that really does give you a sense of hope, and I think it was mentioned in the last plenary session as well. I think it's really now about how we capture all of that knowledge, how we listen, reflect, and learn from each other. And I think in doing that, how we can really move forward and really start to overcome the many, many challenges facing our health and social care systems. So in Northern Ireland, we are on our own journey, our integrated journey, and we've been on it for quite some time. So we have integrated our health and social care systems. And they're integrated structurally, they're integrated in legislation, but I think it's fair to say in practice we're not as integrated as we should be. And like so many of you, we are facing considerable financial challenges. Our waiting lists are unacceptable, and our recent census figures shows that our population's health and well-being is not where it should, or indeed where we would want it to be. But as I said, we are on a journey. We have excellent examples of integration, of innovation, of true partnership working. We're developing new models of care as part of our transformation journey. And later this year, we're actually rolling out our Encompass programme. So that's going to deliver a single digital care record for all of our citizens across the region. But I think for us, it has to go beyond examples. So if we're really to truly make the change that we need to, we have to integrate at every level. It has to become the norm, or as we would say in Northern Ireland, how things are done around here. So our focus in Northern Ireland recently has been not just on how we deliver health and care, but how we plan our health and care services. So for the last 2 years, we've been developing a new integrated model called ICIC23, and that's really a model for planning health and social care. It's based on collaboration, it's based on partnership, and it really does recognise that many of the solutions to the problems we face lie beyond our traditional boundaries. So as part of our model, we are now establishing new partnership boards, and we hope to have them established next year. And those partnership boards really bring together not just health and social care, so not just primary, secondary and community care, but actually our voluntary community sectors, our service user and carers. And in Northern Ireland, we have community planning partnerships. So they're facilitated by local government, but they bring a gateway towards housing and education. So we're bringing all of those partners around the table and really in that space empowering them towards local planning. So really looking at what are the services that we need in local areas based on local need. So our approach is the population health approach, which has been a key focus throughout the conference over the last couple of days. And I think in the plenary yesterday, one of the presenters said, I think it was, think population, act local. And I think that's something that really does resonate with us moving forward. So as part of that journey for the last couple of years, a lot of what we've been doing has been reflecting on what's happened in Northern Ireland in our integration journey, on our past, what has and what hasn't worked. And that's been really, really important in making sure that in developing this new model, we're giving it the best possible chance to deliver what we need. And that's what we're all looking for here today. Improved health and well-being outcomes for our population and reduced health inequalities. And that reflection must and has gone beyond Northern Ireland. And it kind of goes back to what I was saying at the start about this room, about the talent, the expertise that there is in this room, and actually how we use that to harness that knowledge and that potential moving forward, and why conferences like this are so, so important. So I'm delighted to be here this afternoon to invite you all to Belfast for the 24th annual conference in April next year. Again, that unique opportunity to all come together to hear more about your innovations, your ways of working. A lot of the conversations and the sessions I were in, you know, they're work in progress, so it would be really, really great to hear more from them next year to see how they've progressed, but also then to give us the opportunity to showcase to all of you our integration journey within Northern Ireland, and also to showcase, if I'm not being biased, our beautiful scenery and our vibrant city. So what I would say is visit Sydney, but then please, please do come to Belfast. I think, do I need to push a button? Do I need to do it? Yeah.